Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
In today's Neighborhood Health Watch, robotic surgery and urology. Urology deals with diseases of the male and female urinary tract and the male reproductive organs. When medicine, lifestyle changes, and other non-surgical treatments do not ease your urologic symptoms, your doctor may recommend surgery. And fortunately, less invasive surgical options are often available. Dr. Eugene Park from Henrico Doctors Hospital joins us now to talk more about robotic surgery. First of all, thanks so much for joining us.
Well, thank you for having me.
Yes, tell us a little bit about robotic surgery and how it's used when it comes to urology.
Well, robotic surgery refers to minimally invasive surgery.
Okay.
That means doing things with small incisions. And it commonly refers to using an operating tool called the Vinci robot. It's a wonderful tool because it allows us to do things we can't even do with our own hands.
Right.
We have very small incisions and we can do things very precisely.
Well, that was my next question. Why should a patient consider that?
Well, the number one reason is having smaller incisions. It depends on the type of surgery, but we can actually do things like reconstruct parts of the anatomy. We can dissect things in a more precise fashion than we can with just our own hands or even telescopic instruments.
Is there any patient that would not be a candidate for this?
Well, certainly if you have a complicated medical history, it can make it more difficult to have minimally invasive surgery, but in expert hands, I think that you shouldn't count yourself out. You should just meet with a doctor and discuss it.
How would a person find a doctor to get an opinion on this?
Well, you start with your current physician, but there are a number of doctors in town who specialize in robotic surgery. It's always hard to find the right doctor. And number one, you need to trust your doctor.
What's the downtime from this?
Well, it depends on the type of surgery, but certain surgeries, like robotic prostate surgery, we expect you to have an overnight stay in the hospital and be able to go home and rest up at home the next day.
Now, you can do a lot of things with the robotic surgery. Is the prostate surgery perhaps the most popular?
It's the most common surgery to do in urology, but we don't limit ourselves to that one surgery. So any surgery of the urinary tract can lend itself to minimally invasive surgery. I operate on the kidneys, the adrenal gland, the ureters, the bladder, so it's not limited to the prostate.
Talk a little bit briefly about some of the symptoms, just for people to know what to look out for when it comes to dealing with urology.
Well, usually there's some presenting symptom that makes someone want to go to the doctor. With the prostate, it usually manifests as urinary symptoms, urinary frequency, a slow urine stream, getting up often at nighttime, those kind of things. With prostate cancer, though, often it doesn't present with symptoms. That's why you need to have your screenings. You see your doctor, you get a blood test called a PSA, and you get a physical exam.
Okay. Thanks so much for joining us, Dr. Park. And you can find more of information on the robotic surgery and when it comes to urology on our website, NBC12.com.